You're listening to Stephanie and Fox, where we aim to educate, enlighten, and evolve your intimacy.
You can find us at evolveyourintimacy.com to learn more about counseling, self-study courses, intimacy, sex education, and the retreats that we provide.
This show contains discussions about relationships, intimacy, and sex, and is meant for those that are 18 years and older.
Now sit back, relax, listen up, and get ready to evolve your intimacy. Welcome to the Evolve Your Intimacy podcast. This is Stephanie, and tonight we are going to be talking about a program to help you remember consent and consensual sex, making it the best you can. Also, we're going to learn how to talk to partners about our needs and our wants. We have so much good stuff we're going to talk about. We're going to talk about STIs and how to destigmatize them. But of course, I'm not the only one talking about this. I have an expert on. And our expert tonight is Dr. Evilyn Dacker. And she's a board-certified, integrative, and holistic family physician specializing in sexual health and consent. Her unique approach to wellness incorporates pleasure as an essential aspect of healing, trauma, and illness. Also, in addition to everything else that she does in life, practicing medicine, probably just, 1,000 other things, she was the executive director of Sex Positive Portland from 2018 to 2020. She teaches other healthcare providers about sex positivity, destigmatizing STIs, and so much more, and how to keep an open mind about the alternative sexual practices. Everything that we talk about here on the show, she lives and breathes it as well. She also hosts workshops, and I'm just excited that we have the ability to have her on the show tonight. So let's take a quick commercial break, and then we're going to be right back with Dr. Evilyn Dacker. Ladies, are you ready to take your intimacy to the next level? Head over to evolveyourintimacy.com to learn more about intimacy, relationships, and sex counseling.
And gentlemen, do you need a little bit more? Head over to our website to learn tips on how to communicate with that special someone and ignite that flame.
If you enjoy our content and guests and would like to help us grow, go to our website, evolveyourintimacy.com, to follow, like, subscribe, and comment on all of our social media accounts. Now, let's get back to the show. And yes, we are back. This is Stephanie from the Evolve Your Intimacy podcast. And tonight we are going to be talking with Dr. Evilyn Dacker about some really awesome programs that she's written. And I'm just going to jump right in. Dr. Evilyn Dacker, how are you?
I am great. It's so nice to be invited and meet you here. Thank you.
Well, thank you for joining us. So just kind of tell our listeners who you are.
Yeah, I am a holistic family doctor who lives in Salem, Oregon. And I do your basic primary care. In addition, I have this mission to recognize that sexuality is part of our holistic health and medicine. And so I have created different workshops and ideas to just help everybody recognize the importance of their sexual health and wellness as part of being healthy in general.
So you created a dating workbook that teaches people how to advocate for their needs and their desires using the acronym, and I love this, STARS. Can you tell us what that stands for and just open up the book for us? Tell us what that means, and I'm so excited.
Yeah. So, as I was learning about sexuality, let me just back up and tell you how it came to be.
Okay.
Because it all is important. As I was learning about sexuality, I realized that many subcultures, sex positive subcultures, did this thing of creating a container for themselves. And the way they created a container was talking about their STI status and their needs and their desires and their boundaries and what they wanted out of that container. And I just remember my mouth dropped and I thought, why doesn't every single person do this? I mean, everybody should talk to each other before you have any sex or intimacy. And I went back and I played with the acronym and I came up with this acronym called STARS. And I created it for two people. I created it for my patients so I could give them something to think about as they were starting relationships. And I created it for my son who was about to go to college so that he could actually bring it to colleges. And so I created it for young adults and for people who are wanting to really get the most out of their relationships with one another and to make sex and intimacy really yummy. So STARS is an acronym. That's what I believe is one of the 5 most important things that we should know about ourselves and then actually communicate them with a potential partner or partners. So the acronym, I'll say it really, quickly, and then we'll go through each piece. So the first S is your sexual health, which includes your STI status. I believe that if we actually talk about our STIs and talk about testing, we're going to destigmatize it, and we're going to be able to recognize the importance of taking care of ourselves and taking care of each other. So first one's sexual health and STI status. The second one is turn-ons. That's a T. Turn-ons. What is it that you like? What turns you on? What do you desire? What makes sex yummy for you? How do you like to be touched? What do you like? Do you like kink? Do you like vanilla? Just the whole gamut. What is it that turns you on? The next one is A, and that's avoids. And avoids are your boundaries, your triggers, possibly your trauma, if you have them. Where is it that you just don't want to go to? You're not really interested in, because so many times we make assumptions about each other and then we never discuss them. So we find out where those avoids are only when we start crossing them or they're crossed within us. So in order to avoid them, you talk about them. The R is relationship intentions and expectations. That's a long way of saying, what does sex mean to me? What does sex mean to me? When I engage with somebody, what is my intention here? What is it my intention in a relationship? What is it my intention in this scenario? And then the expectations, another way of thinking of that is aftercare. What are my expectations? If I'm going to have sex with somebody, what do I really expect from them? And people say, oh, we shouldn't have expectations. Let's be, kind of Buddhist and not attached. But the truth is we all have expectations. So let's just own them. Let's own them and let's say them. And then we may not get as hurt. And expectations can be easy. Oh, I just want you to check in on me tomorrow. Or I like to cuddle after sex, or I don't like to cuddle after sex. And then the last one, which is the S, is safety needs. And, at first it was safer sex protocol, but I realized that it's bigger than that. It's really what we need to feel safe so we could co-create this container. And of course it includes STI prevention and, prevention of undesired pregnancies, but it's even more than that. It's how do I feel if I'm drunk? How do I feel if I feel unsafe? How do I tell people that I need to let my friends know at 9:00 that I'm okay? How does my race and my culture affect my feelings of safety? How does my religion and spirituality, and how do I see sex? Is it something sacred? Is it something taboo? And the other one I added in was also about, what if you have ADHD or neurodiverse or have another way of thinking that you need your partner to understand so that you can actually come together and co-create something beautiful and safe.
I absolutely love that. It's one of probably, to me, one of the most revolutionary conversations that you can have. Now, granted, not many people are having these conversations because they're embarrassed. So I'd kind of like to put it into a practice with an imaginary person. So, you said safe sex protocols. And I love that, how you said that, because what if we hook up with somebody, we're at a club dancing, we hook up and people are like, it's just a hookup. I'm not going to tell them everything. It doesn't matter. But that's mind blowing to me, because it does matter, because we are allowing people inside of us at sometimes and into our genitals, but we're not going to talk and have the conversation. And so I feel like this model is great for just coming up with something. Here's my elevator speech, and it doesn't have to be forever long. It's just an elevator speech. And so can you give us an example of how it would look, how it would flow?
Sure. In fact, we could do it together.
Okay.
How about that?
Okay.
So I'll start it. And so, this conversation could be like very intense and take days or take a long time, or it can be very short. And sometimes, like if I'm meeting somebody for the first time, I start it by saying, "Hey, do you want to play a game with me?" And they're like, I have two games I play with people. First one is guess what job I have, which, as having a purple hair and pierces, they rarely guess what I do. So that kind of makes them warms them up. And then my second one is like, "Hey, do you want to play this game with me? It's called Stars." And they're like, "Sure." I'm like, "Okay." And I kind of go through the acronym really fast. And I'm like, "Okay. So and I'll do it with you. Let's play this game."
I love it.
My last STI check was a month ago, and I was checked for gonorrhea and chlamydia, and I was checked just in my vagina. I get checked for gonorrhea and chlamydia probably every 3 to 6 months, depending on who I have sex with and whether or not I'm using protection or a condom. So I last was checked. I checked for HIV, syphilis, and I do get the herpes antibody test. I do that about once a year. And just to, because my risk factors for those are pretty low. I also once a year get a gonorrhea and chlamydia test in my throat as well, because you should test every place of entry. And how about you? What's your last STI check?
My last STI check was, I don't even know what month it is. This is October. So it was 4 months ago, and I did a full panel. So I got tested for everything. But I did not get tested in my throat. And it's so interesting that you said that, because I have not been tested in my throat before, and I'm going to schedule that.
Yeah. So just a little, when you said the full thing, I would go back and say, so what does that mean? What is the full panel?
Okay. So the gonorrhea, chlamydia, syphilis, the HPV, the herpes HSV, and then AIDS.
Okay. Great. Mm-hmm. Most people don't know what's in the full panel. And usually, like, HPV is not part of the full panel, because that is only get tested every 3 to 5 years, depending on how old you are. And the herpes antibody also, most doctors don't do it because it's controversial.
Yes.
So oftentimes, like, I want to know when they say the full panel, what that actually means, because a lot of people don't know. And when you hear the full panel, it's like, oh, what is that? So I often very clearly say where I got tested as well. And yes, the recommendation is to get tested especially if you're non-monogamous or have multiple sexual partners, that you get tested in every point of entry. So if you have anal sex without condoms, then you should get tested in your anus as well. Sometimes you can be positive in your throat without knowing that, and even being negative in your vaginal canal or in your anal canal. So it is a good idea to get tested every point of entry.
I love that. Absolutely. And,
yeah.
Okay. I'm not going to go. We're going to stick with this.
So the next thing I'm going to talk about is my sexual health. So I am postmenopausal, which means that sometimes I need a little bit more lube. I need a little bit more lubricant. And I really enjoy using silicone lube. And I just like normalizing that. So don't think it has anything to do with you, or not because I'm not turned on. It's just the way my body is. Mm-hmm. And I have no other issues. How about you? Do you have any sexual needs or issues around, or something that I should know about, just so that I could just be aware of who you are?
Well, I am ADHD and scatterbrained. I am perimenopausal, so it's coming. It's on its way there. And I really, even though most of the time I may not need lube, I really enjoy lube, and I like silicone. That's pretty much my go-to. So there's no allergies there. No allergies for you?
No. Great. So I'm going to skip around, actually, because sometimes the best way of doing stars is actually rats. But I like starting with the STI, and I do that because I like to hear how people respond to that. And if they're really uncomfortable, then I may know that, maybe they're not a good match for me, because I want somebody to be able to be comfortable with that. But sometimes you don't really need that first S until later, when you know you're going to have sex. So I'm going to go to R. For me, sex has a lot of different meanings, and my intentions with you would be to just explore. Let's get together and just maybe No penetration. I really am not interested in penetration for the first time, but I really would like to just get to know your body and some of the things that I really expect. I really don't like ghosting, and I so prefer that if whatever it turns out to be, I'm a big girl and I could listen to like, hey, I just don't feel this, or this is going to be work out, or it was really fun, or other feelings that may come up. So I'm really open, and I really dislike being ghosted, and that's really important to me. If that's something that's difficult for you, or if you have a habit of that, that's okay. We may not be a good match. And another expectation that I have is that I do like to cuddle after intimacy. Some people, I do like to cuddle, and
Wow. I'm still processing what you just said. Okay. So my intentions, remember, I'm learning this too. My intentions are, I love that, to explore. You just eloquently just said all of this, and I'm like, yes, I want to do that. I want to do that too. But
and you can say that.
Yeah, I mean, everything that you said, I love the ghosting part, because I like you said, I'm a big girl. If you don't want to be with me again, tell me. I was thinking, when you said cuddling, I was thinking, well, do I like to cuddle? Because I've never really asked myself that. I guess I love a good laugh. I love, processing and talking with people. I'm so sapiosexual. So a good conversation is just as sexual to me. And I love that afterwards, and kind of, what did you like? What did you not like? Kind of debrief and see if we are a good match moving forward.
Yeah. So let's talk a little bit about avoids or boundaries. Sexually, I do like to play with sensation. I wouldn't necessarily say I'm into BDSM. I don't really like, a lot of pain, honestly. And I don't like power roles. So I'm not into DS situations. And if that's something you're interested in, great, but that's not really my cup of tea. I also have a pretty strong boundary about two things. One is to not hit me in the face, unless we've had another conversation, that's okay. And I also don't like to have sex if me or you have drank more than 2 alcoholic drinks. I find that consent could be a little messy when you're intoxicated, especially in the first few times. So I usually like to have the first few times I'm with somebody to be alcohol free. My other boundaries are, I really don't like any humiliation. I really dislike age play, especially when I'm the older woman. I don't want to play mommy.
Yeah.
So, those are pretty much my avoids. I have no trauma that I haven't yet processed. I don't really have any triggers. So, but I'd like to know if you do. What are some of your boundaries?
Absolutely. So, I don't do anal with anybody other than my husband. Let's see. There's trauma in my life, but nothing I haven't processed and dealt with. I do, like a little bit of the impact play. I don't hit me in the face type thing. I don't like that either. But, some of the impact play, I love playing with sensations, hot wax or ice, or, just the different feelings on the body, part of exploring. Just coming up with it off the top of my head. I'm going to do your workbook, but coming up off the top of my head, that's pretty much it as well.
I have a question. I have a question for you though. If you ever had any if you're ever triggered in a sexual situation, how does that look for you? Because I want to know, because some people it looks like fawning, or some people it looks like freezing. And I just want to be able to be in touch with that in case that comes up.
I cry. I have really big emotions.
Okay.
And it's not like tears of, it's not like, oh, it's just, I cry. I have, it's just who I am. So that's my go-to. I'm getting so much better at controlling that emotion and not allowing it to overpower, but sometimes tears still fall down. And, we talk about it afterwards. I would, or during it, I would like to talk about it with you. if that were to happen.
Great. I love that. I'm a crier too, so that sounds great. We talked. You told me a little bit about what you like too, and let me tell you some of my turn-ons. I love sensation play, and I love really like soft touch. I like to start slowly. I actually really enjoy starting by grounding in with somebody. Like I need to ground in and breathe a little bit and feel comfortable before we enter into that more sensual, sexual, intimate space. I love sensation. I love to start slowly. I love soft touch. I love all of the things you talked about.
Mm-hmm.
I'm just like, my pain level is probably around a 6.5 out of 10.
Okay.
Maybe I could go up to a 7 or an 8, but like, that's it. After that, I'm not into going really hard or for very long at those high levels. I really enjoy all sorts of sexual activity. I love penetration. Oral is also very interesting for me because I am one of these women that don't really like a lot of touch on my clitoris, around my clitoris. The way that you play with my clitoris is really more like on top of it and just pressure. So no direct stimulation on my clitoris. It just numbs me out. I don't really like vibration. So if we want to use some sex tools or toys, whatever you want to call them, sometimes I like calling them sex tools. That could be fun. But I also really prefer just using body parts.
Oh, okay. I love it. Thank you for sharing. This is like a whole first date for us, and we're just met. But I mean, it seems like this would be a great first date conversation.
Mm-hmm.
So,
and just understand, like, I've done this many times.
Oh yes,
so it's easy.
Yeah, I get that. And the
Is there anything else that you like that turned?
No, I mean, I will let you know as it comes up. Yeah.
Okay. The last is the safety. Like, in order for me to feel safe with you, we kind of talked about, grounding in and having this conversation really co-creates safety. I already talked about alcohol, other chemical enhancements. We could discuss that, but, I prefer sober initially. Otherwise, I feel pretty good. I don't have any other physical safety needs. You mentioned that you have ADHD, so sometimes that may play into it. But otherwise, yeah, I think I'm not worried about getting pregnant with you. And depending on what we could talk about using what I call barriers. I don't like saying the word protection because you can't ever be fully protected.
Yes.
So
thank you for saying that.
So, and that's me.
Safety wise, I use protect or not protect. We just got through saying that, and here I go saying it.
Barriers.
I know. I don't know. I was thinking protection. Barriers is what I was trying to say. For penetrative sex, but I mean, I'm not getting pregnant, especially with a woman. But I'm not getting pregnant. Period. I've been fixed. Other than that, I really don't have any safety concerns or issues.
Great. Yeah. So, it's very interesting talking about language, right? Like protection.
I know.
Versus barriers.
We're going to get to that. So let us take a really quick commercial break. And we're going to come back and we're going to talk about how we can start to destigmatize that stuff, the STIs, and what language we need to use. So many great things. So stay tuned and we'll be right back.
Not quite ready for sex therapy, but you still have questions about sex, relationships, intimacy, and communication?
Join us every first Thursday of the month at 7 p.m. Central Standard Time on SDC.com for a free hour and a half of sex question and answers. We talk about all things sex, intimacy, communication, and relationships. Not part of SDC? That's okay. Go to our website, evolveyourintimacy.com. Click on the Fun tab, go to the dating site, and join it for free on us.
Awesome. And we're back. This is Stephanie from the Evolve Your Intimacy podcast, and we are speaking with Dr. Evilyn Dacker, and we're going to start talking about how we can destigmatize STDs or STIs and STDs. We're about to get into that. We're going to start talking about how important language is as well. And so my first question is, can you share the difference between STIs and STDs and why using the correct language is so important?
Yeah, what we're talking about is infections. So we're talking about pathogens. We're talking about viruses and bacteria and parasites. Diseases are the sequelae, or what could happen if you get an infection. Like, if you get HIV, then you get AIDS. When we use STDs, then I feel like that's really stigmatizing sexuality. In fact, I think that STIs are the metaphor for our sex negativity, for the way we're uncomfortable with sexuality, which is why I like talking about STIs, because it's a really good way of helping people transform how they feel about themselves and sex. So I'm going to ask you a question. What do you think is the 3 worst STIs out there?
For me personally, syphilis, gonorrhea, and HIV.
Okay.
Those for me.
The 3 worst STIs are guilt, shame, and fear.
I love it. I have all of that.
I mean, we all do, right? When we're brought up with our sex education, saying that you're going to get something because you're promiscuous, and the only way to avoid STIs, that was even like part of the CDC way of avoiding STIs, is be monogamous, only have one partner, use condoms, don't have sex. I mean, that's what we're taught to avoid STIs. So what do we do if we have sex with more than one person? What do we do if we're living with a chronic STI? What do we do? Even like, I know people that have had sex with one person and ended up with herpes. And all of a sudden they feel like stigmatized and they can never have sex again and they'll never find a partner, because our stories around it are so negative and so toxic. So by actually recognizing that these are infections, just like, hey, we just went through 2 years of a pandemic.
Yes.
Where standing within 6 feet of somebody could give us an infection, right?
Yes.
And long COVID, I would say long COVID is a disease, but we're not calling it a disease, are we? No, we're not. So, and the other part about calling it an sexually transmitted infection, is that when we think about what sex is, most people think of it as penetration. So everybody thinks like all you need to do is wear a condom and you avoid STIs because you're avoiding penetration, like penetration of the anus, penetration of the vaginal canal, or penetration of the throat. But sex is so much more than that. Like sex is all of it, right? It's not, and I just recently started thinking about like the word foreplay. Why don't that's sex.
That is
that's
sex.
Sexual activity. That's part of the main activity. So let's just call it play. So people could actually get one of the STIs, such as herpes, by never even having penetration. You just have to have skin to skin contact. Yes, it's easier, it's more transmittable if there is some penetration, but it's not necessary. People could give themselves herpes if they have an outbreak on their mouth and then they touch their genitalia. So, we need to recognize that there's just so much more to this. So STIs are our metaphor for our sex negativity. It's our metaphor for just feeling really uncomfortable, feeling guilty that we're having sex, feeling ashamed that, oh my gosh, I didn't use a condom. What are they going to think? Feeling ashamed if they got something. And the fear of getting an STI can keep so many people from connecting with one another. And that, I think, is the saddest thing in the world.
Absolutely. And so when we begin to destigmatize them, what are some of the common stigmas or misconceptions about STIs?
Well, that you're promiscuous if you can get one, that you need penetration to get one, that you're going to get a disease and be marked for life if you have one. And what are some of the ways of reframing it is that they're just pathogens, they're just infections, and we give each other infections all the time. We give each other colds, influenza. More people die from, COVID than they've died from herpes, which, doesn't kill anybody. I mean, there's very few people that actually do have a really bad herpes outbreak and they have to manage it, and that is challenging, but the majority of people don't. In fact, the majority of people who get herpes in particular, because that's the one that I really find the most fascinating, because it's the one that most people are scared of. Most people who get herpes don't even know, their partners don't even know they have it.
Mm-hmm.
So they get it from someone who either didn't disclose or doesn't even know they have it. In fact, 80% of people could have it on low levels and they never actually break out, or they break out in ways that aren't typical. Like they don't have the source. They may have could have pain in their vulva, in their vagina, or pain on their cervix, or in their anus, and it could feel like hemorrhoids. So it's just much bigger than what we're taught in, middle school, high school, sex ed, and see all the scary pictures. I really feel like the way we're taught about sexually transmitted infections is very, it also others people. It others people.
Mm-hmm.
We tend to put people in boxes, like men who have sex with men. Well, they're at high risk of HIV and monkeypox, and yes, we do see that maybe people with penises who have sex with other people with penises tend to have higher rates of those. But why don't we ask ourselves why? Why do they have higher rates? Is it their anatomy? Is it their behavior? Or is it their internalized stigma? Is it their internalized shame? And is it their internalized shame and don't have outlets for sexuality? And so they may go to bathhouses and have multiple sexual partners. And these are questions I've actually asked people who participate in those activities. Like, I don't think that what they're doing is wrong, but sometimes I have asked some people, like, what motivates you? Like, why do you do that? Why do you not use condoms? And what is behind that? And how does that make you feel? And, I realize that we're not asking those questions. We're just putting people in boxes and saying, if you do this, then you're at risk. And that means you're bad, or you're scary, or we have to fear you. So putting people in boxes of like heterosexuality, putting people in boxes due to race. Some people, like Black people, tend to have higher rates of some STIs. So we can't just say, oh, but Black people have more sex, or they don't use whatever. It really has to do with deeper socio-ecological reasons that this happens, because they don't have the same resources or education or ability to, or even know how to say yes or no. So many people don't know how to say yes or no to things, which is why the whole STARS talk is so important.
Yes.
Going back to that.
Oh, we're going to keep going back to it too.
Yeah. I mean, going back to the STARS talk and why sexual health and STIs are so important to bring up in these conversations, because the more we talk about them and the more we educate each other about them, just like, I just said about not using the word protection, because have you ever had a broken heart?
Oh, absolutely.
Okay. So, you weren't protected against that.
Yes, exactly.
So many more people end up leaving a relationship with a broken heart than they do leave with a pregnancy or an STI. So why are we just trying to protect, let's just not use protection, because it's impossible to protect ourselves. But you could use barriers, sexual barriers. You can make decisions about maybe not have certain engagement. You can make those decisions. So by actually talking about things, we start changing culture. And we cannot change culture until we feel, we're not going to get comfortable in doing this until you hear other people doing it and you have people ask you. So STARS really is not only for people who are in different sex positive subcultures. It's not only for people who are polyamorous and non-monogamous or swingers. It's not only for people who are queer. It's actually for everybody. Because by doing this and by talking about STIs and making that that to me is the most important way of of quote unquote protecting yourself.
Protection. Yes.
It's the best way of trying to have safer sex is by actually having this conversation and talking about when you were last tested. And so sometimes I've asked patients, and I'm like, so you're dating, have you had this STI talk? And they're like, oh no. And they're like, oh no, he was in a long-term marriage. I had this happen once. He was in a long-term marriage and so was I. So no, we didn't talk about it. And And I did her exam, and I'm like, hey, we should just do an STI test because you have a new partner. And she was like, why? I don't need to, because, we're both monogamous. I did her STI test, and she came back positive for gonorrhea and chlamydia.
Mm-hmm.
So, it's like, you can't make assumptions about people. I've had other people say, oh my gosh, I asked him and he was so offended at me. I'm like, yeah, we have to start asking more so people don't realize that there's nothing offensive about it.
Mm-hmm.
If we talk about it as a way of like, I want to protect my partner.
Mm-hmm.
I want to protect you. I want to, protect again. I want to reduce the ability that I'm going to harm you in some way. So let's talk about our sexual health, and let's talk about the things that, they may feel a little uncomfortable, but getting naked could be a little uncomfortable too.
Absolutely. And going off of the language, instead of, protection, maybe trying to normalize safer sex protocols. What's your safer sex protocol?
Mm-hmm.
Changing the language. And I feel like I believe so strongly. And once we start changing the language, we start changing mindsets. And I don't know if we change mindsets before we change language, or if we change language before we change mindsets. But we cannot accept things and accept change if we are still thinking the same way. And so, like you just said, I mean, that language is important, and talking about it and normalizing it is important.
And think about pronouns and gender, right?
Mm-hmm.
Maybe it was like only 5 years ago where people were like, why should I have to ask people's pronouns? Or why do they want to be a they? They is plural, right?
Mm-hmm.
I mean, there was a lot of resistance to it. And all of a sudden we normalized it. People started just saying, hey, it's important.
Mm-hmm.
It's important to validate people for who they are. And, now in a hospital, people have their pronouns on their name tags. It's on the intake sheets. Like, we're just normalizing it. Therefore, we normalize that people don't have to be cis male and cis female, right? We normalize that you can be a gender that feels right to you. The gender is a social construct. So if we could do that, and that's pretty darn big, I believe we can normalize having these conversations with each other. I believe that we can normalize and mainstream the idea that you're going to sit down on a first date and just go over your basic stars.
Mm-hmm.
It doesn't even have to be as intense as what we did. It could be really simple. Like, this is what I like. This is my agreements. This is what is important to me. This is my STI standard. And this is what I need just to feel safe. I mean, it could be really that simple. And it doesn't have to be done in any particular order either. It's just to remind you those 5 things that we should think about.
So what do you tell people who have an STI that they're living with? How do they bring that up? What do you recommend? How do they say that to their partners? How do they start that conversation?
Ooh, that's a big one. There's no one right way. Some people, like, say they are living with herpes or HPV. Some people might want to say it right away, or on their dating profiles, or like, hey, this is who I am, just so that they don't go deeper, right? If somebody's like, oh, I can't date you, then like what? Other people recommend to get to know someone and then disclose. Disclosing is very important. It can be very scary, especially for someone who hasn't done it before. Disclosure could be very scary because you may get rejected, and nobody likes getting rejected. But if somebody rejects you, they're not doing it because of you. They're doing it because of themselves. Mm-hmm. And that's what I tell people. It's like, it's not you. It's their fear. It's their internalized shame. It's their internalized sex negativity. And you can't blame them. Look what we're taught. Mm-hmm. And also, it may have to do that they have other things going on in their life and they just can't take that risk. And you will find someone who loves you for who you are, regardless. I mean, what's the difference between somebody who has herpes and someone who has severe anxiety or mental health issues, right? We tend to love people because we love them. Mm-hmm. And moving away from that. So yes, disclosure could be hard. And I have worked with people who it's really about letting go of their internalized shame and fear, and then recognize that if somebody rejects them, it's because of that person's internalized shame and fear.
I work with clients, who have one client in particular that I'm thinking of. Clients come to me and they're like, oh my gosh, I just was diagnosed with whatever. I had one client tell me at one point, she had HPV. No, No, HSV. And she told me she would rather have a cancer diagnosis than that because she felt her entire life was over. And that is such a powerful thing to think about. People really feel like their life is over because of this stigmatization on herpes.
Oh, absolutely. In fact, I think I can't quote this right because it's quoting off the top of my head. Courtney Brame, who runs a wonderful podcast for people called Something Positive for Positive People, and he's interviewed hundreds of people with herpes. He did a survey, and it was something like 78% of people, when they first found out their diagnosis, felt extremely depressed. Mm-hmm. And a portion of those felt like they, had suicidal thoughts. Mm-hmm. And a huge amount of people go and feel like they could never find another partner. He has all these statistics, and again, I don't know them off of the top of my head. And the other thing is, when somebody has that, I really try to point them to the resources of other people who could show them that it doesn't have to, that story doesn't have to live with them. And it's frightening because some people, because of their guilt over sex and the taboo around sex, they feel like they'd rather have cancer.
Yeah, I felt that was probably one of the most powerful realizations is, wow, you really are ashamed of this, and there's nothing to be ashamed of. You had sex and you contracted something. Okay. It's manageable. It's not going to kill you. Like you said earlier. Right. And no one has ever died of herpes, but we've died of COVID. We've died of, so many other things that are non-sex related. So when they're having that STARS conversation, do you think that the people who have the STI just normalize it and say, hey, you know what? This is what I have. Or do you feel like they should try to educate the person? Like what's the right protocol for that?
There is no right protocol for that. There is no right protocol. As someone who does not have herpes, I want to make that clear because I do a lot of work with people who have herpes. As someone who does not have herpes, I really can't say. I think that any way that you can do it when somebody's comfortable, I think disclosure is very important. How you disclose and when you disclose and whether or not you need to educate somebody, that really is an individual thing. I think sometimes a lot of people want more resources. And I heard one person say, yeah, I have herpes. And, if you want more information about this, I could point you to some resources. So that's a really good way of doing it. And just like, there's a lot of information out there, but, to have to be the teacher is also puts a lot of burden, unnecessary burden on the person who has the infection. So I would just say, you don't have to be the teacher, but maybe pointing them to some resources if they ask, or first ask if they want them.
This is some excellent information, and I am so excited to continue to talk to you, but we have to take a very quick commercial break, and we'll be right back after our sponsors.
Do you want to be on a ship with over 6,000 wild, naked friends? Dropping anchor in exotic countries, exploring all the sexiness the world has to offer?
Come join Stephanie and I on the next Bliss Cruise, where you can attend one of our world-renowned play shops, swim nude in the crystal blue pools, or enjoy one of the many theme nights and clubs the ship has to offer. Come join us at evolveyourintimacy.com/cruises.
Hi, this is Stephanie from the Evolve Your Intimacy podcast, and we are talking with Dr. Evilyn Dacker, and we've talked about destigmatizing STIs. We've talked about her STARS model and so many things. I want to kind of turn the conversation a little bit to what do people say, or how do people navigate being medically stigmatized by professionals when they are disclosing that, or they find out that they have an STI? How do they navigate that?
Ooh, that's a hard one. Unfortunately, physicians aren't taught very much about how to navigate sexuality. Mm-hmm. And I could speak from a physician's point of view, not from a patient's point of view with this, but I have had some issues there too. Physicians when we think about sexuality, we think of it as problems. So somebody comes in, they have erectile dysfunction, we write them a prescription for a pill. Somebody comes in, we do their STI test and they come back positive. Maybe we'll have our medical assistant call them. Maybe we'll have them come back in, or we'll just be like, we'll call them and say, oh yeah, you came back positive for gonorrhea and chlamydia and I wrote a prescription for you. And do you have any questions? So a lot of times patients feel left alone.
Mm-hmm.
If they're all of a sudden they find out they have a diagnosis and they're like, okay, here's a pamphlet, goodbye. They feel really alone because physicians aren't taught how to navigate their own biases, our own discomfort. It's scary because it means like if we're going to talk about sex, we have to feel really comfortable with that. I often, with, let's say my male patients, they'll come in and I'll be like, so I use the word intimacy because it's a little easier for people, right? Like, how's your sex life? I just think how's your intimacy? And, depending on their age, I might be like, oh, are you having more trouble with maintaining erections, and normalizing it. I just really try to normalize the conversation. Like, do you have a self-pleasure practice? Do you orgasm? How is that for you? As a physician, I just have practiced saying the words and being able to say them. It normalizes my patients being able to receive them. So unfortunately, we have a long ways to go to educating physicians. Mm-hmm. And we have a long ways to go with having physicians understand their internalized bias, their unconscious bias around sexuality. I believe it could change. Mm-hmm. And I believe that we could all do a better job of it. And, as I said, I wrote star stories for my patients. And I really think like getting this information to physicians so that they could tell their patients like, hey, there's this great framework that maybe you could learn. And the framework is how, you can learn how to talk about STI status. And maybe you could think about like what your boundaries are, what you need. Like, you don't have to go into all the stars thing and then just give the patients the framework for them to kind of explore and the resources to explore it. But I think that if we, as healthcare providers, we just don't have the same understanding. Like, I was just at this conference today on clitoral pain, and it was put on by this urology group. And they were talking about how important it is to have gynecologists and urologists. And some of the problems, one of the reasons some people have clitoral pain is because they have low back pain and herniated discs. But, they were saying how they didn't know anything about the urologist really never thought about like lumbar disc disease, and why would they think about that? Because they're urologists and they have to get the neurosurgeon involved. And I'm like, oh my God, this is primary care stuff. This is stuff that every family physician should know. Like, it shouldn't just be to the specialist. You don't need to just go to a gynecologist. Like, your primary care, the first person you walk into should feel comfortable enough to understand that sexuality exists in our entire lives. So like if you're having issues, like if you're having vaginal pain and you don't ask a person about it, they may never tell you because they think it belongs to the gynecologist. Mm-hmm. And yet that their vaginal pain may have to do something with their back or something with a medicine that you gave them. I mean, we just need to normalize it. And so people aren't so left alone. That's my perspective as a family physician.
I love that. And so let's say that, how do you suggest people who have, how do they advocate for themselves, who have been discriminated against by medical doctors?
Find a new medical doctor.
Absolutely. Number one.
And this also comes to say like people who are non-monogamous, right? Who practice non-monogamy. Usually if they're not asked, they're not going to say it. People who practice kink or BDSM, right? If they're not asked, they're not going to say it. So yes, it sometimes is, if you're comfortable, tell your provider. Say, I may have a ring on my finger and yes, my husband and my children, but we are swingers. So could you please do an STI test? Mm-hmm. I mean, so that's, yes, it does take advocating for yourself. Yeah, I know. I mean, I went to the doctor once asking for an STI test, and she didn't even know how to do it. I had to teach her how to do it.
Wow. So
Yeah.
that's sexual health is not taught in medical school?
No. I mean, not beyond erectile dysfunction and, contraception and STIs and just all the problems. No, not really. Maybe it's taught for 4 hours of all of medical school.
And sex is such a huge part of our life. I mean,
I know.
You walk down the street, everybody you pass, besides a slight few, are sexual. And they've had sex, they've been sexual, they've touched themselves, but it's such a taboo topic. And so I'm going to switch lanes again, just kind of using the language and talking about it. Do you feel like that would help reduce sexual assault, especially like on college campuses?
Oh my God, yes. 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 Which is why I'm so passionate about teaching this in colleges. Yes. I think that if more people had this tool, the STARS talk, if more people had that tool, then they would be able to advocate for themselves. It's a consent talk. It's a safer sex talk. It's a way of co-creating a container, even if it's just at a party and you're hooking up with somebody. Right. I thought, like, oh, wouldn't it be cool if everybody just wrote their stars and had it like on a billboard, like on a board. And then if you're going to hook up with somebody, you could go read theirs,
Oh, that's a great idea, actually.
Yeah. I mean, like, just normalizing it. So I definitely feel that having a conversation that, you could think about, you've already thought about it for yourself, because the most important person to do a STARS talk with is yourself. So once you got it down for yourself, then you could definitely advocate. Like, think about, I'm forgetting his name. It's 2 A's and he's a comedian. He had that sexual assault where he took somebody to his room and she ended up giving him a blowjob, but she didn't want to and left. And, it was this big hoo-ha. And I was like, oh my God, if they only had a STARS talk, none of that would have happened.
Mm-hmm.
None of that would have happened. So yes, I think that it is a very powerful tool. And again, changing culture. We're not going to change culture if we continue to have sexuality as a taboo, because we're going to continue having, people don't know how to navigate it. A lot of people who were brought up as boys weren't taught the skills of how to navigate and how to listen and how to understand boundaries. And people who were brought up as little girls don't know how to say, are only taught to say no. So how do they know how to say yes? How do they know that they're able to enjoy and could ask for what they want? They're not just there. Sexuality is not there just to have a penis, have an orgasm.
I was just talking about this with some fellow colleagues who are not certified sex therapists. And we were talking about, people are women, traditionally, those who have been raised as feminine women, or not feminine, but as women. I can't use my words tonight for some reason, but we're trying. We're taught that we say no, say no, say no, say no. We save it for, from the South, save it for marriage and all of this stuff. And then on your wedding night, you're just supposed to magically know what to do. And it's unrealistic. And so we were just talking about just how sometimes it's just so unrealistic and the pressure that we put on ourselves. But this STARS model is actually exactly what the world needs to knock everybody, back into some good, wholesome conversation. And I love that you created a workbook. So tell us about the workbook.
Yes, because I feel so passionately about this, and because sometimes it's really hard to get it all just by seeing the acronym. I created a workbook, which is kind of like one of those cosmopolitan quizzes. You can go in the magazine and you just check things off. So it's like a Cosmo quiz, but only 33 pages long. And so, it would probably take a good 20 minutes at the most, to go through it. But it has a lot of questions like, do you like this? Do you like not? Is this your avoids? What about? So it goes, every section has a bunch of options to help you think about, because you wouldn't necessarily think about these because we're not taught to think about them.
Yes.
So I created this workbook for people. It's free. It's available because the more we know, the more we can advocate for ourselves, and the more we're going to change culture.
And where can they find the free workbook?
They can find it at the website maketimeforthetalk.com. Make time for the talk. It's a little long, but when you type it in, you kind of remember to make time for the talk, because the talk is important. Make time for the talk. It's right there on the first homepage. Just put in your email, download a free workbook. There's no strings attached. I'm not going to harass you by giving you emails any emails I would send out are emails you're going to want to get, because they're going to be full of juicy information, including when I do workshops, because I do some online workshops where we actually practice it. Sometimes I have 6-week courses where we go deep diving into it. And so all of that. And then there's also the guidebook I wrote for Destigmatized STIs, which could be purchased on my website. That is a guidebook that talks about all the STIs, and it does it it does it by ungendered language. I never use gender it. I never use categories. I don't other anybody. All I do is I use anatomy and behaviors. And there's sections, there's 2 big plus sections. There's a whole section on herpes, and there's a whole section on human papillomavirus or HPV. There's a section on what to use to minimize STIs. There's a section on how to disclose, and the STARS and communication. So it's jam-packed with information.
And anybody can take these workshops?
Yes. Once I have them. I have been so busy this year, I haven't put them on, but they will be having new workshops in 2023.
I'm right there with you. We host workshops too, but have just been so busy. I'm like, okay, well, they're going to get there. We're going to do them again in the very near future, just not today. Right. I love that. I love that that's a free resource as well, the STARS. And then they can purchase the Destigmatizing STIs off of your website as well. And is that on the Make Time for the Talk website as well?
Yes.
Okay.
Yes. That's on that. Yeah. And then, more information. I have some Instagrams. I have the Instagram that's Make Time for the Talk. That has about STARS. And then I have an Instagram called Sex Med Doc. That's sexual health, destigmatized. That's more my personal one. So that's 2 other good resources just to get some quick information.
And you present your information in a way that, of course, is not stigmatizing. There's no shame. There's no guilt. But you present it in a way it's fun. You're just really fun. You have this charisma and this spunk about you that makes people want to talk to you. So I have been following your Instagram. Research plus fangirl. But so I love how it's not all clinical and all of that either. I mean, there's clinical aspects to it, but you're not talking over people's heads.
I try not to. I feel that I won't understand it.
Yeah.
I want to be able to understand it. So, awesome. And I want everybody else to understand it. As I said, I really believe that we could make a difference. We could make the world better, as well as all just have better relationships and better sex and treat each other in a way that is kind and compassionate, and this is part of it.
I appreciate you taking the time just to talk and educate me and all of our listeners. What do you want our listeners to walk away with? What's that nugget that you want them to walk away with?
To do the STARS talk.
Yes.
It's just normalize these conversations. Take a chance, take a risk. Take a risk and just saying, hey, I often tell my patients, I'm like, just say, hey, my doctor gave me this thing that she wanted me to try out. Like blame this podcast. Say, hey, I heard this on the podcast.
Yes.
You want to try it out with me? And even do it with your partner. Like if you have a partner, you don't have to, it doesn't have to be something new. In fact, my partner and I do it about once a year. We kind of sit down and kind of go over it again because things change. So practice it, learn it, use it, and be one of those people that are going to make the world a better place.
You are such a beautiful spirit, and I want to work with you and help you change the world. So
awesome. Thank
you for taking the time tonight, and hopefully we can do this again, and I will we'll talk to you soon.
Great. Thank you.
All right. Good night.
It's great being here.
Thank you.
Good night.
Thank you for taking time out of your day to listen to our show.
We are Stephanie and Fox with Evolve Your Intimacy. And remember, you're not in this alone, and we are here to help.
You can check us out at evolveyourintimacy.com, and if you subscribe to our newsletter, you will receive free resources monthly to help evolve your intimacy.
Have a good night.
Have a good one.